Does the thought of even doing the simplest of things get you completely exhausted? Or after you do something that seems ridiculously easy or simple, do you feel completely exhausted? Well, you wouldn't be alone, and there's a really good reason for it. If you've spent any more than 10 days in the hospital, then you want to stick around for this video, because in this video I'm going to talk about the physiologic problems separate from why you were admitted to the hospital in the first place that make rehab or recovery a little bit more exhausting, as well as some solutions on how to get back to your normal activities without feeling so tired all the time. If you're new to this channel, I'm Tara, I'm a neurologic physical therapist, and on this channel we talk about anything and everything related to mobility, health, fitness, and really just movement in general in the context of neurologic injury, with the end goal with empowering you with as many tools as possible to live a more active, mobile, fulfilled life. And all that being said, today we're going to talk about fatigue, prolonged hospitalizations, how the two are linked, and then how maybe some lifestyle choices that you've made after you've left the hospital are further contributing to the reason that you feel tired all the time. So first we're going to talk about all the systems that are impacted by a prolonged hospitalization. And I promise by the end of this video, it's going to come full circle. So it is important to understand how your body was affected by your hospitalization, how that's impacted you after discharge, and why that is still impacting you even years after you've been discharged from the hospital. So what exactly are some of the things that happen, or the systems that kind of break down a little bit when you're in the hospital for a prolonged period of time? Well, one is that they have found that people that are hospitalized for as little as 10 days lose muscle mass. They have found that people that are in a hospital for a prolonged period of time have alterations in their muscle EMGs. So that's basically a measure of the voltage that is getting to the muscle. So there's alterations in that after being in an anti-gravity position or a laying flat position for as little as 10 days. They have found that people that lay flat for a prolonged period of time have decrease in bone density. There's some cardiac deconditioning that occurs. Stroke volume decreases by 30%, and orthostatic intolerance appears with as little as 72 hours of laying flat on your back. And orthostatic intolerance is basically just your body's inability to adjust your blood pressure when you change positions. So when we go from laying down to sitting up, our blood vessels and everything need to adapt to make sure that blood keeps pumping up to our head. When this system is not working properly, the blood pressure will drop, you'll feel dizzy or lightheaded. And all of that together is why potentially you may still feel an overwhelming sense of fatigue even after you leave the hospital. So why do I tell you all this? One is, if you're currently in the hospital or your family member is still in the hospital, that mean therapist that comes in and wants to disrupt your restful sleep in the bed and drag you over to that recliner just 3 feet away and take all that time to get all your tubes and all your wires over. As much as it seems like that's not important, it is super duper important. They have found that just getting sitting upright and out of that flat position can prevent a lot of those body systems from breaking down, as I just described. So I promise you, we're not mean, and we're not trying to make your life miserable, and we're not neglecting you or leaving you in that chair out of spite. There is a reason why it's super important to sit up, and we try and make you as comfortable as possible, but it's still not going to be comfortable the first few times you do it. But that is the rationale. There is actually science behind why we do that, and it's really, really important. And you might not see it now, but down the road you will thank us, because it will impact your overall recovery. But the other reason that I go through that laundry list of problems that can happen after laying flat on your back is there things that we sometimes forget, and we don't realize that even a few of those things on that list that we know are associated with laying on your back for as little as 10 days will make you feel fatigued. So your heart not being as efficient, not getting as much blood into the body will make you feel fatigued. Decreased muscle mass, decreased fibers, decreased voltage to the muscle. All of these things just will put more demand on your body when you're doing simple movements that might not have been too much of a demand before your hospitalization. So these things will make you feel more fatigued. And that leads me to kind of the next section in the video. And this is the point where most of you fall into, is what happens right after you're discharged home. And for the most part, you would fall into the category of being sedentary. And, you know, we hear this a lot in the news now. There are a lot of downsides to a sedentary lifestyle. And in this case, due to no fault of your own, possibly no fault of your own, you know, will make your body fatigue more quickly. You're just deconditioned. Now, this could be because you have to sit because you're not walking yet. Or maybe you just choose to stay in the bed because you don't really have anything else to do. And that's extremely common. Or for some of you, it's that you can't get out of bed. And so you have to wait for someone to come help you. And that causes you to be more sedentary or spend more time than usual in bed. And that is all totally understandable, but we need to find a solution, or we need to find ways to get out of that flat position, because you're just compounding to the struggle your body is going through to recover by laying flat for prolonged periods of time. And I actually just went through this with a patient who does spend a lot of time in bed, maybe only an hour or two a day out of bed. And so what we came up with was a plan. And I am sharing this with you so that you guys can implement the same thing if you find that you are spending a prolonged period of time in bed. I would say if you're spending any more than 10 hours in bed, including any naps or times where you go back to bed during the day, then this plan, you need to put some kind of a plan in place to increase your out of bed time. I think 10 hours in bed is probably enough time to get good quality rest, preferably at night, and then trying to stay up during the day. So I know most of you probably can't start there. So my suggestion is whenever you get out of bed, just add an hour. Start there. Just add 1 hour of staying up, even if you feel like you want to go back and lay down. And then every week, increase that by 1 hour a day. If you're only getting out of bed on the days that you have home health care, please, please, please work with a physical therapist and find a way that your family can help you get out of bed. If you can't, sit the head of the bed all the way up. If you're not in a hospital bed, put tons of pillows under your head. That still helps to get your head elevated. But the ideal situation would be to find some way that your family can help to get you out of bed, even if it is that you're just going to sit in that wheelchair. It makes a huge difference on your overall fatigue. It's not going to be easy. It's going to be hard. You're going to want to get back into bed. It's not going to be comfortable. But remember, this is a training process and you can do this. Just start increasing that time out of bed to the point where you can be up during daylight hours and only be in bed for anywhere from 8 to 10 hours at night. Now, as you transition to spending more time out of bed, the big complaint that we usually get, or that I usually get, is that like you just get sore. Your bottom hurts. So if that is you, instead of laying back down, there are other things you can do to kind of what we call relieve that pressure off your bottom. It's basically your bottom is just getting sore because as humans, we're not used to having pressure on our bottom for prolonged periods of time. You didn't realize you were doing this, but when you were more mobile, you were shifting around quite frequently. And now that you're not as mobile, you're not shifting around as much, that increased pressure actually decreases blood flow on your bottom. And that's one of the reasons why it gets sore. So my first recommendation is to find a wheelchair cushion that suits your needs. I will put a link in the description. I wrote a blog on this where I gave a review on a few different cushions. So I will put that link in the description below. Go through there. It depends on what your needs are as to what cushion is going to be best. And I have links to places where you can purchase those cushions in that blog post. The other thing is what we call pressure reliefs. So if your bottom is getting sore, I recommend every 20 minutes doing some sort of pressure relief. So there's a variety of things you can do. Remember what I said? It's that increased pressure on your bottom that decreases blood flow and what causes that pain. You really just have to kind of unload that skin just a little bit to get fresh blood flow in there, and that will help with the pain a little bit. So there's a few different ways that you can do that without even getting out of your chair. You can do a side to side pressure relief. So you basically just lean to one side and totally unload one bottom cheek for what I would say 30 seconds to a minute. So you just hold this position where you're just leaned to one side. You want a little bit of clearance or a little bit of light under between your skin and the cushion. That's how you know you got a really good pressure relief. And then do the same thing to the other side. If you feel comfortable, the other pressure relief you can do is lean forward. So if you have a family member that can just put a chair in front of you, you could do a forward leaning weight shift. That's really scary for a lot of people. But with a chair in front of you, it might help to kind of ease that anxiety a little bit that you're going to fall out of that chair. And I say do it every 20 minutes. If you really want to not have a sore bottom from sitting for prolonged periods of time, pressure reliefs are fantastic. Now, if you can stand, but you just don't feel comfortable walking, and that's why you sit in the chair, go over to your sink and stand at your sink. I'm telling you, it is better than any parallel bar system in any physical therapy gym. In this exercise, what we're doing is we're just working on standing. It's so important that you get as much standing time in as possible. And this is just a safer setup for those of you who are still getting to a point with your therapist where you're getting safer, but you might not be there yet. This little roll right here helps to block your knees if you're someone who feels like your knee is buckling. That's what this pad is here for. So you can use a kitchen counter. I love a kitchen sink for early standing activities because you do have the sink that you can kind of grab onto. You have a chair behind you, so you're really safe. And then if you still don't feel comfortable, having someone on either side of you definitely will add a little bit more safety. And then you're literally just working on coming up to standing. Having your knees blocked in this manner will make it easier for you to get all the way up to standing. And then my recommendation is you stand at least 20 seconds if possible. If you're just now getting to a point where you're standing, 20 seconds will feel like an eternity, but that would be a good goal to shoot for. And then down, slow, nice and controlled. And you can pull on the counter. Again, if you're in the very early stages, this is just getting you off of your bottom. So you can use as many tools as you need to just to have an opportunity to stand every day. Grab on and pull up. Hold it 20 to 30 seconds. And then down, slow. Just stand for 30 seconds at least once an hour. That will also help to decrease the pain and prevent that urge from wanting to get back in bed. If you're in a reclining wheelchair, I forgot this one. If you're in a reclining wheelchair, you can recline the chair all the way back. We also consider that a pressure relief. And yes, it does take your body weight off your bottom, lets fresh blood flow back in, and that should also help to decrease the discomfort that you're feeling from sitting in the chair for prolonged periods of time. And now here is for those of you that just say, well, I can't walk and I can't stand. Or my therapist told me that I shouldn't stand because it's not safe. Totally understand all of that. So there is kind of like a risk-benefit calculation that needs to go on. I'm a little bit more on the less conservative side. I think if you have a caregiver or you have a family member that can stand on either side of you and you can go over to that sink and the chair is behind you and it is locked, worst case scenario is you're going to fall back down in the wheelchair, which isn't going to be super comfortable, but you're not going to fall and hit the floor. But it is so valuable. You've got to find a way to stand. And then maybe you're just someone that you can stand, but you aren't comfortable walking yet. So you just wheel over to the bathroom or you wheel over to the kitchen. Well, that is sitting. So you're prolonged sitting, and that is what we call a sedentary lifestyle. And that affects a ton of systems in your body. Your bowel and bladder system, you don't empty as efficiently. There are some correlation with some heart issues or cardiac issues that are associated with prolonged sitting. Mentally, I feel like it has a huge impact on patients that I see in my clinic to sit for prolonged periods of time. So what I suggest is set a schedule just like you used to set a schedule when you went to work and stick to it. I call it a standing schedule. And I would start with 3 times a day standing and kind of reversing that sedentary lifestyle and all the risks that come along with a sedentary lifestyle, and stand at that sink 3 times a day. Start with sit to stands. So do about 10 sit to stands. Now remember, this is replacing all the walking that you used to do to get to the bathroom, to get to work, to get to your car, right? We need to replace all of that. So if you can stand, then you can do this program. But 3 times a day, start 3 times a day. And you're going to go over to the sink and do sit to stands, minimum of 10, and rest. Then you're going to do some seated marching, 3 sets of 30 seconds, and you're going to alternate that with seated punches, 3 sets of 30 seconds. So 30 seconds of punches, rest for 5 to 10 seconds, 30 seconds of marching, rest for 5 to 10 seconds, back to the punches, and go through that 3 times. And go through that routine 3 times a day to start. Remember, you have to get back up to like what we would just consider a baseline activity level that you were doing before without any exercise, just that baseline to replace all that sitting that you're doing now when you would have been walking throughout your day. So the take-home messages today are, if you're feeling fatigued and it's not neuro fatigue or some of the other things that I've talked about in other videos, I will link the fatigue videos that I've done before in the description below. But this is the other huge problem. It is just because you are not moving. So take home message, if you're spending any more than 10 hours a day in bed, step 1 is increasing your out of bed time by 1 hour and progressively increasing that. Doing pressure reliefs when you're sitting up in the chair to prevent you from getting uncomfortable and being tempted to get back into bed. If you're already sitting up in the chair for prolonged periods of time, but you're still sedentary, then implementing a standing kind of activity program 3 times a day. So I hope this video was helpful. If you're new to this channel and you haven't yet subscribed, definitely hit that subscribe button. I've said it before, but I'm just always shocked that 60% of the views, 50 to 60% of the views on this channel are from people that are not subscribed. So definitely hit that subscribe button, like this video. Those things help for YouTube to show these videos to more people, and in doing so, you're helping other people that are in a similar situation as you. But again, I enjoyed spending time with you all today, and I will see you in the next video. Have a good day.